With the emergence of the novel coronavirus earlier this year, public health officials instructed Americans to stay home and social distance in order to prevent the spread of the disease. These guidelines have been especially important for adults age 65 and older. So for Nevada, this means that approximately 500,000 elder Nevadans are now primarily homebound and at a risk of experiencing social isolation, a figure that makes Dr. Reed's goal to ensure that every elder Nevadan has access to medical, social, and daily essentials in their home all the more critical. So Dr. Reed, as you've noted, our state's Aging Services Organization, Nevada's Aging and Disability Services Division, the Sanford Center for Aging, UNR's Dementia Engagement, Education, and Research Program. We quickly came to launch together Nevada Can, that integrated service response we're so proud of, working to ensure that our senior service providers can collaboratively support every older Nevadan who is now homebound. So, like we've been talking about, social isolation. So we have to think about getting essential services to our seniors. So Dr. Reed, I know you've leveraged everything you can to help create that Nevada, or work with the Nevada 211 hotline to make a Nevada Can a COVID response section, as well as all the other services. But how do you think these new relationships and integrated approach can be beneficial in the long term after the coronavirus crisis abates? And how can we bolster the success and then export it hopefully to other states that can use our model?
Thank you very much for that question, Senator Rosen. And also thank you for your advocacy on behalf of older Americans as well as elder Nevadans. Your engagement with this committee and the hard work that you do is impacting lives every day. And we in Nevada are grateful for your hard work. I will say that the relationships that we formed really are the central, sustainable component of what we've done with Nevada Can. We stood up this statewide integrated coordination of efforts in order to address the pandemic. However, by bringing together our state unit on aging with community-based providers, with county providers, and thinking about how to triage requests for help from elders directly through a centralized program to those providers, there is now a new network of support that has been created, and that network of support can be sustained in the long term. I will say that resources are going to be required to help to achieve that at multiple levels. So the first relates, as you mentioned, to 211 and what's called the no wrong door approach to providing services to elders through aging and disability resource centers. We have to have the funding necessary to ensure that no matter what an elder needs or where they access the aging services system, they're able to get connected with the broad range of services that can help them to meet their needs. So that entry point and that triage to those other services becomes critical at the highest level. The next level are the individual functional areas. So thinking about how we can put resources specifically into addressing social isolation, resources specifically into bolstering the technology and the connectedness for telehealth, and resources obviously into food security and continuing to provide nutritional assistance. Those core functions of this network also need to be sustained at their own individual level. And so it's the connectedness between all of those different elements and the relationships that we've created that I guess you could call is a silver lining to come out of this, because we've always tried to work together, but this pandemic has forced us to really streamline and coordinate efforts in an efficient manner.
No, it's so exciting. I just can't wait to keep telling everyone about it and let your inbox be full so people can copy our model. But I want to speak briefly about, Senator Gillibrand talked about the digital divide as it relates to broadband. But we know that seniors oftentimes have difficulty even using equipment because of their eyesight. They might have a hand tremor, just the physical limitations of sometimes being a senior. So what do you think are some of the new and innovative ways that we can help seniors use the technology? If we're going to provide them telehealth, et cetera, et cetera. How do we overcome those physical limitations?
Right. I think that issue is important both in terms of providing social support as well as through telehealth. I'm going to speak very briefly about telehealth first. It's interesting, the Sanford Center for Aging at the School of Medicine at UNR has been providing telemedicine services for several years, but that was a telemedicine cart talking to a telemedicine cart in a rural clinic. And that's no longer possible because very few elders have telemedicine carts sitting in their living rooms. And so what we've been able to leverage are new online platforms. And also we're able to potentially get tablets to people that don't have the technology, but that doesn't address the barrier of people not being able to use technology. If you hand an iPad to an older adult who has never held an iPad, they're not going to know what to do with it. And so we have tried to stand up our back office support within the clinics to provide pre-visit technical assistance to ensure that they're able to access the technology, get online before connecting them directly with our providers. And some of that work is, as I mentioned, being supported by the CARES Act emergency funding that went to the Health Resources and Services Administration to support the geriatric workforce enhancement programs nationwide and bolstering their telemedicine and telehealth services. On the social isolation side, it's a similar situation. And so what we've done through the NEST collaborative is to engage volunteers in reaching out and specifically just providing technical assistance to older adults to connect with their existing groups of friends, as well as to learn how to use technology to be able to access telehealth and have social connect. It's essentially IT support for elders to learn how to use the technology effectively, in addition to providing the technology and providing the services via technology. All three of those elements have to be present. Thank you.
I'm so grateful for your innovation, and we've all had our challenges with the Zoom calls, that's for sure. But we look forward to seeing you back home in Nevada and continuing and supporting the good work that you do. Thank you.